Vaccine known to prevent cervical cancer in young women, but now a federal panel recommends that young boys get the HPV shot too.
The Advisory Committee on Immunization Practices voted unanimously on Tuesday to vaccinate 11 and 12-year-old boys to prevent the spread of the human papilloma virus. Well, 10 on your side, Ann McNamara joins us now to explain why boys and, of course, why now.
Well, first, Alvita, I don't think many parents know that in Virginia, all 3 doses are a school requirement. For girls, the first dose must be given before 6th grade, and parents can opt out if they choose to after reading the proper materials from the Board of Health. Now, as for boys, this new recommendation is likely to become part of the routine physical. I spoke to one pediatrician who changed his advice to parents because of this new federal recommendation.
Well, it's a big change and it's a big announcement.
A new recommendation from a federal panel says boys ages 11 to 12 years old should get vaccinated against the human papilloma virus. The CDC first recommended the vaccine for girls 5 years ago to prevent genital warts and cervical cancer.
The data says that 85 to 90% of people are infected with HPV sometime in their lives.
Experts say the HPV vaccine protects boys from genital warts and rare forms of oral and anal cancers. Local pediatrician Dr. Robert Fink says immunizing the boys could be more beneficial for the girls.
It certainly is an added benefit to protect women from HPV.
Taken in 3 doses over 6 months, the vaccine has been available to boys since 2009. Dr. Fink says only about 1% of them have been vaccinated.
There are a lot of concerns that parents have.
And only a third of adolescent girls have completed all 3 doses. Data shows it's a hard sell to their parents.
You know, all those things that we've been doing for years, you just kind of, it's a no-brainer, but it's new, so I just want to know more information about it.
The vaccine can cause some redness or a lump at the site of the shot, sometimes a low-grade fever, sometimes nausea. For especially girls, sometimes they can get dizzy and can pass out.
Another concern, age and increased promiscuity.
It's like 11, 12, good gracious, but I guess that's just what it is today.
If you wait until after someone's sexually active and they've been infected with HPV, it's too late.
There's also the price. Dr. Fink says the total cost can run from $600 to $800. Insurance companies cover it for girls because of the CDC recommendation, not so for boys, but Dr. Fink expects that to change. A spokesman for the Department of Health says there are no statewide statistics on how many children have the HPV shot, and that's because the department is not required by law to keep them. And Dr. Fink says oftentimes percentages used in these discussions about HPV, those are taken from insurance statistics. Ann McNamara, 10 on your side.